Okay, we're going to do a little talk about protecting ourselves. We're going to talk about violence in the emergency room. So we did a little evaluation of our violence in our ER. In the past week, I can tell you we've had somebody that has been punched in the stomach. We had a nurse that had her shirt ripped off, almost, to where she had to run out of the ER. And we had one that was dead. So we're just looking at different ways that we can prevent some of this and de-escalate our patients. The thing is that we don't do it probably early enough, because we have that patient that's steaming and standing around waiting. The longer the wait, the more they get aggressive. And we need a standard of care, that getting their clothes out, taking their belongings, put them in scrubs. The cell phone's a problem sometimes because they call people and then they get mad, or they call 911 from our rooms. So we took a look at 6 studies. Our big question was, are the emergency department staff who have de-escalating training compared to those without training at a decreased risk for workplace violence? So of course, through our 6 studies, most of it was different types of training. There's MANT training. I think the first initial training of that is almost a week long, and then like your renewal can be 4 to 8 hours, and that's every, I think, 4 years. CPI
St.
training.
Francis has CPI. They are actually implementing right now, and all staff has to go through, but they're offering it through various classes throughout the year. So they're a one day 8-hour training program, and then I don't know about follow-ups because we're just now.
All of this is kind of expensive. That's most of our limitations to the standard of care. Through our 6 studies, we did have, the strength is from a level 1 to a level 4. We have 2 studies that were a level 1, and we have 1 study that was, I think, a level 2, and I think we had 1 level 3,
And then
2 level 4s, and 1 level 5 study. But throughout the studies, most of them said pretty much the same thing. Standardized assessment of psych patients in conjunction with de-escalating training reduces the incidence of workplace violence in the ER, mostly, or psych settings, I would say. More, you might see that though in the ICU, of course. You probably see some of those patients. And of course, intoxication is the big risk factor. Some of the practice changes that we want are statistical analysis, pre and post implementation, like surveys, do some surveys prior to training and prior to just more standard of care, everybody doing the same thing. And audits, you have to audit. And then self-assessment, staff involvement, tracking the incident reports and the sensor reports.